Welcome to Scrubbed In, where we dive deep into health, wellness, and their stories behind the experts shaping the future of medicine today. Today, we have the pleasure of speaking with Dr. Maria Awais, a specialist in internal medicine with expertise in endocrinology, diabetes, respiratory illness, and much more. With over 15 years of experience across Pakistan, Oman, and UAE, Dr. Maria brings a holistic approach to patient care. In this episode, we'll explore more about preventive health, managing diabetes and hypertension and obesity trends, and some of her personal insights through fun rapid fire and ranking rounds. So let's get started. Hi, Dr. Maria. It's very nice to have you here with us in Scrupton Podcast. So before we start everything, get to know about more about you, like what really led you to come into this field and become a doctor.
First of all, thank you for having me here today.
My pleasure.
It's an honor to be part of your podcast, and you're doing an amazing job here.
Thank you so much.
As for me, my name is Dr. Maria Awais. I'm internal medicine specialist, and I have specialty in internal medicine, subspecialty in endocrinology and diabetes, and I have done a postgraduate diploma in obesity and weight management. Recently, I finished it, and it's a funny story. What led me to become a doctor? Because when we were young, like say 30 years ago, we didn't know much as people know today.
Okay.
So either you can become a doctor or you can become an engineer or something else, or arts if you're not good at studies. So
That's
that
exactly what it is with all the South Asian families, if I'm not
exactly, because now I'm very glad people have a lot of choices and students know a lot more about all the things. However, I was always good at studies. So, and I was I was better at, say, biology and all the science subjects rather than maths. So, okay. So it was decided for me to take medicine. However, when I got into the medical school, and I take a lot of pride in that, and I would like to again mention it that I graduated from the most prestigious medical college in Pakistan, King Edward Medical College.
It's nice
But
to
the when I entered the college, when I started my medical education, that was the point when I realized that how much I love medicine. So basically, that was the point that decided that no, I'm gonna do only this and I will do everything. And now I graduated in 2005. But till date, I'm studying, I'm doing one thing after the other because I love this field so much.
Oh, that's what that is when you're into the medical field. You never stop studying.
Definitely,
You just
definitely.
keep updating yourself and everything.
Yeah,
Right?
but there is a difference in the motivation. Some people do it because just to stay ahead in the game, stay ahead in the field. But it's a different when you do it out of love. When you have something that you want to be better or the best at what you are doing. And I think that's my driving force, and that's why I love medicine so much.
Well, that's a lovely point of view. That's nice to hear as well. So now, what exactly we need to know is how was your medical training in King Edward College? Like you said, it is one of the best colleges, top colleges in Pakistan. So that, of course, it should be good. But was that a driving force for you to continue what you're doing today?
Yeah, because I think we were one of those people or that generation. We were blessed with amazing teachers who were more like role models for us. So we had amazing teachers who were very, very strict, but the way they taught us, the way they trained us, the way they took us from one step to other, and how they used to push us to do our best. It was beyond the expectation. It was beyond anybody's, imagination. So what happened eventually that when they make you do so many things, they push you out of your boundaries, out of your comfort level, then you yourself give your 100%. And when you are invested so much mentally, and we are going to the wards even when not asked to go to the wards just to see the patients. This was one of the elements. Second element was because the King Edward Medical College, it is associated with the biggest hospital in Punjab, I would say, Mayo Hospital. So we had a lot of number of patients there pooling from all over the country, and very, very sick, very, very complicated cases. So in such a short span of time, we used to see so many cases, and most of them were non-affording patients. Most of them were patients who are there because they cannot go anywhere else in the private setup.
Alright.
So it was another driving force. the idea of or the sentiment of helping them out. So we used to go out of the way to help the patients out. And I think that is something that stayed with me after 30 years as well. Even now, irrespective of the fact that the patient is affording, non-affording, or it's a patient just consulting me by the way and not in my clinic, that thing that we have to go out of the way, out of our comfort zone to help our patients, that has never left me. And I think this is the biggest contribution of my medical college and my medical training towards my professional life.
Huh, that's lovely to hear. So basically, it is your mentors and the exposure which you had got back in your UG days, which has led to what you are today,
Definitely,
the
definitely,
driving force.
definitely.
So, how was your you have an extensive practice in Pakistan, then in Oman, and now in the UAE. How different is it comparatively?
Yeah. Actually, practicing medicine is very different depending on which part of the world you're practicing it. As I mentioned before, in Pakistan, it is mostly patient driven.
Okay.
It's mostly out of the care of the patient. We are not having as much facilities there. We have all of them, but not as, what you say, generously as we have here.
Absolutely right.
So, what we do when in clinical practice, we have to put more emphasis on our clinical diagnosis, our clinical judgment. So, most of the diagnosis we will make in the clinic without any labs, without any advanced diagnostic things. And I think that is something that trains you in a best way. And then, if you have worked and survived in that setting, you can work and survive in any settings in the world. When I moved to Oman, there was a transition definitely because we are dealing with a different patient demographic. We are dealing with different kind of patients. However, Oman is a very lovely place. I love Oman too much. It's very close to my heart. And today, even I think that if I retire, I will go back to Oman
Okay.
because people are very nice there, people are very lovely there. From medical practice point of view, of course people have more support from the government, there are more facilities there, so more emphasis there is on the preventive medicine, on community medicine, how we can improve the general health of the population.
Oh, right.
So it's a very different concept from Pakistan. And moving forward, when we move from Oman to Dubai, it's like you were in slow lane in the traffic and suddenly you decided to jump into the left lane.
Okay.
So you have to keep rushing, you have to keep the pace up because the best thing about Dubai is it gives you an opportunity to practice medicine by the book. It gives you the opportunity to practice medicine according to the guidelines. You have all the advanced medications, all the advanced facilities, everything at your fingertips, and you can access them at any time. And that makes a lot of changes in the patient care as well as in our approach when it comes to that. So I think every place I have practiced has shaped me in a better way to become who I am today. And I think Dubai is an amazing place if you are interested to be up to date in the medicine and to practice medicine as the modern world is doing it today.
That's a very lovely way to put it. So, if there are any other young doctors who are looking forward to come to Dubai or to the DGCC in general, I'm sure they would really be happy to hear your insights on that.
Yeah, definitely, because this is something that Oman, I had amazing time there, but that's something I was missing there.
Mm.
I felt like that I am just at a dead end.
Oh,
I will lose my reflexes, I will lose my knowledge if I will not practice it according to our guidelines, according to the protocols.
okay.
But once you come here, then everything is very streamlined. It's very good. We have a lot of support. As I put it, we are in the resource abundant facilities here.
Okay.
So it makes a lot of difference when it comes to patient care. And as a doctor, it satisfies you a lot because whatever you want to do for your patients, you are able to achieve it here.
Right. That's very nice. So, now we will dive into our segment to which I want to know more about, talk to you about why regular health checkups are very important. Why do every other doctor emphasize a lot on regular health checkups? So let's talk about the most common chronic conditions. That's the diabetes in this whole world. That everybody is worried about diabetes. Everyone, you will, oh my God, I have diabetes. I have sugar. If you have to say in the common man's term. So, Dr. Maria, can you please shed some light on this disease?
Yeah, I will just start with one line with the why regular checkups are important.
Mm-hmm.
I always tell to my patients that regular checkups are like GPS.
Okay.
So you are already heading that way.
Okay.
But if you know which way you are heading, you can make the right turn at the right time.
Okay.
So, in the same way, regular checkups give us an idea where we are heading. And if we know exactly where we stand at a certain point of time, we can make right decisions at that time. We can make right changes at that time. That would change the course of our life for the next 10 years. Coming to the diabetes, it's a very pressing issue nowadays because one, it puts a lot of burden on the healthcare budget, healthcare system. Secondly, it's a chronic disease. Chronic disease means it's gonna stay with you for a longer period of time if you have it. And sadly, in today's world, it's rampant. We have a lot of patients with diabetes. 1 in 5 persons either has prediabetes or diabetes or insulin resistance. It's a very, very scary number because 1 in 5, it can be one person sitting in this room as well. And that makes it very relevant, that makes it very, very important to have more knowledge about it, to know more details about it, and most importantly, know more how we can prevent it or delay it for, or if you already have it, how we can control it in a better way.
Very nice. So, how exactly does the lifestyle of the people in the UAE in general, be it the locals or the expats, affect the diabetes, the rate of diabetes in this country?
Yeah. As we know as doctors that for diabetes, a very strong genetic element is always there. And if you are genetically predisposed, if you have a family history, or you come from a race which has more possibility to have diabetes, of course, your chances to have diabetes eventually are more in compared to a person who doesn't have those risk factors. Have said that, there are a lot of things in the lifestyle, especially when we talk about lifestyle in UAE, because we have a busy life here. It's a stressful life. Uh, Eating habits are not very healthy because everybody is so busy. They don't get time to cook at home.
And we have a lot of restaurants here
We have a lot of
at our
restaurants.
disposals.
And in addition to that, it takes you 15 minutes to get food at home.
Exactly. Talabat,
Yeah, or you can just, drive through is always easy than going for groceries and even more convenient when it comes to the pocket as well.
true.
So most of us choose convenience over health, and that eventually ends up once in a while it's fine, once in a while it's okay. We are all humans after all.
Okay.
But if we are doing it consistently on daily basis, it will have its results and it will make us more prone to getting diabetes. In the same time, because of the busy lifestyle, sedentary lifestyle, sitting in offices for longer period of times, most of the people don't get time for exercise regularly. That is another factor. Uh, in my clinic, when I get a lot of patients, they start their conversation with the sentence that I'm very stressed at my work. So, stress is another big element that will put our hormones all over the place, and eventually it will affect our blood sugar levels. And if it stays for longer period of time without any changes, without any intervention, eventually we will have diabetes for sure, in addition to other chronic diseases as well. Another thing is because here the weather is not very, what you say, generous. The weather is not very forgiving.
That's
So we are just moving from air conditioned car to air conditioned room. So we try not to walk outside. When I was training in UK, I was walking a lot from daily basis because that's part of lifestyle there. And I think that is something that we miss when
that's
we are
right.
here in UAE, definitely.
The lifestyle changes back in UK, and you cannot compare the
Yeah, and
of
you
course.
cannot do anything about it because the same people I have seen who here don't wanna walk for 10 minutes, but when in UK they have to walk. So
That's
you
not
don't
the
you
that's
don't
not
have
the
you
yeah.
don't have a choice.
I remember walking for over 6 kilometers, which was very less.
Yeah,
Yeah, so yes, that's very nice. I mean, if you compare the lifestyle, of course, the weather conditions also play a major part when you compare both the countries.
definitely.
So, do you have any suggestions for lifestyle changes for your patients who come for diabetes treatment, or any sort of when they ask you for any suggestions? So, what is exactly that you tell them?
When it comes to diabetes or in general any chronic diseases, or we can say metabolic syndrome per se, I tell the management is lifestyle, lifestyle, and lifestyle. Because yes, medications have their role. There are few points where we have to start the medications, but lifestyle is most important part. And
Okay.
when we talk about lifestyles, we talk about big three.
Mm-hmm.
One is nutrition, one is the physical activity, and third one is the sleep.
Okay.
When it comes to the lifestyle, and first we talk about nutrition, we have to be mindful about what we are eating.
Okay.
So,
Mindful eating.
mindful eating, because what happens is a food that we put in our mouth, it's like a piece of information.
Okay.
It's going to change our body for better or for worse. So, we have to see what we are eating and what we are not eating. Many people know this notion, but they don't know what exactly we mean by that. So, to further elaborate it, carbohydrates should be reduced to the less, proteins has to be increased more. Make sure you are eating the rainbow, you are eating all the greens, all the colors, that beautiful colors nature has given us, and eventually that would make a balanced, good, healthy diet. And then again, in when it comes to certain people where we sometimes we are doing calorie control, sometimes we are just focusing on a certain kind of food, we can further customize it according to patient and give them the best advice that is suitable for them. In exercise, yes, the regular daily exercise is important. What we usually say is 30 to 40 minutes, 3 to 4 times per week is good enough exercise. If you have risk factors for diabetes, more important is to do resistance training or weight training because it improves the glucose metabolism in the body. When it comes to sleep, 6 to 8 hours of uninterrupted
Uninterrupted
sleep
sleep.
is very, very important. And then it starts with because a lot of my patients will tell, I'm sleeping, but it feels like my mind is working all night. Stop using your devices 2 to 3 hours before your bedtime. You should not be pass out looking at your reels. So I think that is something that is with the changing times that has gone worse. But if we can switch off our screens 3 hours before bedtime, more chances are there that we are having good quality of sleep.
Okay, all this sounds really challenging, to be honest. So, are there any patients who come and tell you that, doctor, this is very challenging for me to follow? And in that case, how do you make sure that they adhere to the plan?
Yes, it's a real problem, and we see and deal with it every single day in our clinical practice. Patient adherence, I think, to be very honest, the first step in any patient's management is patient education.
Okay.
If you will talk to the patient in detail, you will explain to them what actually is happening inside your body, and they understand what's happening inside their body and the things I am telling them to do, why it is needed to be done. It's not just do the exercise, it's good for you. No, we have to break it down into smaller pieces of information, and it has to be in a simpler language that is understandable for a patient, and it varies from patient to patient. We have very smart patients, and we have a lot of patients who have no medical knowledge, so we have to vary it between that. But when you explain the patient and all the decisions you have to make it mutually. It's not me telling you to do this, it is we have agreed on that we will do it from this point onwards. Second thing is re-education, reinforcing every single time. Repeat everything you told them, because one time you will tell, they will remember it for a couple of weeks and they will forget. Once they are coming back after 3 months, check on them. Are they doing all the things? If they are not doing, analyze it further. What is stopping them to do from doing it?
Okay.
And after that, address the issues at the basis of it. And eventually, when both of you work as a team and the patient will feel my doctor cares about it even more than I'm caring about it, patient gets more motivated. I always tell my patient, I don't want you to start today and after 1 week start running a marathon. No, It's always baby steps. I always tell them first week, you just need to walk for 10 minutes, brisk walking. Next week, if you're coping up with that, we will increase 5 minutes more. We will increase 5 more minutes, and eventually we will get to our target. When you work with the patient coming at their level in a stepwise manner, adherence is amazing, and patient you will see response from the patients.
Okay. Do you think a family support also plays an important role in patients adhering to this plans?
Yeah, actually, family support or peer support is very, very important, even more important than we give it the credit for,
Absolutely right.
because chronic diseases sadly is something that you have to deal with day in and day out.
Okay.
You have to live with it. And for now, maybe it's just pre-diabetes or diabetes, but eventually it can become a complicated case with a lot of problems that you have to face with, and you cannot do it on your own. So, from family, first of all, we need the mental support, psychological support, knowing that somebody is there with you. Then, second thing is not judging.
Okay.
Yeah, no judgment. For example, if somebody is obese or somebody is having metabolic syndrome, don't judge them. Do things which help them eventually, because that's what family does. And third thing is, it becomes very easy, especially in the clinical practice as well. If a patient has a good family support and we explain to them why you are not supposed to eat this and that, sometimes it's a family that is doing my job for them. They are reinforcing, no, no, your doctor told you not to use that. They make sure that patient is adhering to that. So all these things and having the support system, it is very, very important for health as well and for anything in the life, to be honest.
That's very nice. So family support is the major
Definitely in all chronic
all chronic
conditions. Yeah.
conditions. Okay, so now we want to talk more about this condition which is called as a serial killer right now. It is called hypertension. So, Dr. Maria, what should our listeners know more about hypertension?
I think the most worrisome thing and more, that's why we call it the silent killer, because
Absolutely.
it is something that will not give you symptoms
Okay.
unless it has gone so high that the damage has already been done
Done.
in most of the cases. Even 2 days ago, I had one patient in my clinic, and he's telling me, yeah, I am hypertensive for 10 years, but I take medicine when I feel like I'm having the symptoms.
Oh,
And yeah, so I told him this is not the right way to do it, because when you are not feeling symptoms is because your body get used to the higher pressure because it's staying there for longer period of times. And sadly, the symptoms will only come then when it crosses and gets into the dangerous zone.
okay.
And in that dangerous zone, we can come either with the heart attack or stroke or kidney failure and all those things. So that is the most difficult thing when it comes to and delays the diagnosis of hypertension. That's exactly why, where again, I will come to the first point where we started our conversation today, why the regular checkups are important. Because
Okay.
at sitting at home, you might not feel anything. Only when you will go to the doctor's office, you will find out that your blood pressure is on the higher side.
All right. So, how do you encourage patients to know more about their blood pressure? Like, how do you educate them to know that this hypertension is really something that they should be concerned about?
And the simplest way to explain that to the patient is just to tell them there is a water pipe and it has a capacity. And you know what happens when you put too much pressure in the water from there? It will burst from some point.
Okay.
In the same way, the higher blood pressure is putting a lot of pressure in our arteries.
Okay.
And it's, if we will not do anything about it, it's just a matter of time, then something will burst.
Okay.
And if it will burst in the heart or in the brain, that would be a catastrophic event. And we will not like to go to that end. That's why sometimes I have, sorry to say, but sometimes we have to scare the patients a bit. I will not call it scaring, it's just giving a reality check where we are heading so that we take this thing a very serious way. Second most important thing, especially if I take the detailed history of the patient, and if they have a history of hypertension or high cholesterol levels or a family history of heart disease, then we have to be more cautious in certain patients. Then I tell the first step for them is, of course, the diet changes. We tell them not to consume food with a lot of salt. and improve the intake of green leafy vegetables, fruits, and more less number of processed food. This is the first advice. Second is to improve the physical activity, and third is monitoring.
Mm.
Monitor your blood pressure every day for at least 1 week. I usually tell them after that, just take a screenshot of that paper or that information and send it to me. And it will give me, because one reading of blood pressure in doctor's office doesn't mean anything.
Right.
We sometimes call it white collar hypertension as well. People are nervous when they are in the office. Sometimes they are just walking or coming in the hot
Hot
weather,
weather.
and the BP can be high. That's why it's very, very important for the doctor to know, is it the really high or it's just because of the other cofactors. So what I usually do, I take a BP reading even at the time when person is leaving my office, the patient is leaving my office. It will give us a better indication how
Because they must
after
be relaxed after
they must
taking.
be relaxed, and they are not walking, they were sitting for a longer period of time, and their element of anxiety has eased up as well. So it is a better reading, and we usually compare the both readings as well. But again, for me, it's very, very important if you go back home and monitor it yourself every day. It gives us a lot of information, and then we make a decision based on that.
Oh, okay, that's nice to hear. And like how you told when we first started talking about hypertension, about some patients, what are the most misconceptions that patients today have about hypertension?
I will say this misconception is about hypertension as well as about all the chronic conditions.
Okay.
And literally, I'm listening to this same line in Pakistan, in Oman, and now in Dubai as well.
Okay, what exactly is that
That
line?
if no, doctor, please don't start me on the medication, because if I take the medicine one time, I have to take it for the rest of
Rep-
my life.
Right, right.
So, my answer to this is simple. See, your house is on fire. It's your decision. You want to put the bucket of water now, or you stop it because you have to keep putting it on.
Okay,
The problem is, if you will decide, I don't want to put it now, and later on you will decide to do it, most of the house is already burned.
right.
But if we will decide to do it today, we will be able to save it,
Save the
most
house.
of it. In the same way, it's not like you will take the medication and then you have to take it. Y- You need the medication. Damage is being done. You do something about it or you don't do something about it. Medication will only control it till the time you are taking it.
Mm.
However, when we combine diet, lifestyle, exercise along with medicine, many chances are there that sometimes we reduce the medication to the minimum. Or in many cases, when people are able to lose a lot of weight, we can go after without medication as well. So whenever I listen to this line, I say, okay, we do the same conversation again.
So basically, you're saying that you like how we it again coming back to the same thing, like lifestyle changes along with medications and a diet plan is of utmost importance if we have to tackle any chronic disease, be it
Definitely.
diabetes
Definitely.
or hypertension as well.
Definitely. And the most important thing is we usually don't start medications unless it's needed.
Needs, yeah.
And if it is needed and you decide not to take it and delay it,
Hmm.
it means we are giving that disease process more time to do damage in our body. And in many cases, it can be irreversible as well. For example, today you have just borderline diabetes. I can easily manage it with one medication, with the diet, lifestyle, and all that. But if you decide to wait for years without medication, now, straight away, I have to start you on 3, 4 medication there, including the insulin, because your blood sugar levels are not being controlled with just one medication. So it makes huge difference. It makes a lot of difference, and that's why it is very important to early detection and taking an action early on.
Okay. So, like this chronic conditions like diabetes and hypertensions, can they be reversed?
It's a very good question, and we answer this question a lot.
Hmm.
Uh, Not in 100% of cases. Like, I will not say it is 100% reversible. I will not say it is 100% irreversible. Yes, in some cases, but it depends from case to case, patient to patient. If we are already advanced into disease, so it is difficult usually to reverse it, but we can well control it with the medication. However, we are just standing in the borderline. And there are a lot of things in in lifestyle, in diet, we are having a sedentary lifestyle. So we have a lot of things to improve. So usually when we improve all these elements, we improve the blood pressure a lot, we improve the blood sugar levels a lot, and in few cases, yes, we are able to reverse it back as well. I would like to mention one thing in this one, that before diabetes comes a stage, we call it pre-diabetes.
Yeah.
And it is an amazing window. It's my favorite window when it comes to diabetes,
Okay.
because when we fall in that category, if we will not do anything about it, eventually we will definitely have diabetes.
Oh,
However, if we will do the right things in that window, we can 100% reverse it back to normal. So, this is such an amazing window, and I'm so enthusiastic about it. I tell all my patients this is our chance to do the right thing, and we see the results for sure.
so in this is the case when our regular health checkups again come into place.
Exactly, because otherwise you will, like hypertension, you will not know the diabetes also unless the blood sugars are so high that you are feeling very thirsty, you're going to bathroom again and again to pass urine, or you're losing weight or any of other complications.
So, how often do you think any person who are at risk of these chronic diseases, be it hypertension or diabetes, do they have to keep themselves checked regularly? What are the intervals that they have to keep checking themselves to avoid the risk?
Yeah, it's a very good information to have, to be honest. So we usually stratify it based on the family history as well,
Okay.
and age as well.
Okay.
If you don't have a family history and you are 30 years or above, once a year is good enough for you. So, in that checkup, if everything comes well and good, we don't have any problems, any readings coming borderline, we are safe to repeat it after 1 year.
Okay.
However, if there comes something that is borderline high or something that we needs to look more closely onto, we have to do it at least 6 monthly.
Okay.
In the same way, if you have a family history of any certain diseases, we have to be more frequent. And again, the first checkup will dictate how we'll go further on from that point of view.
Okay. All right. So, I'm sure that most of our listeners will be happy to know more about this,
Yeah, because
especially with
it is very practical information to have, because everybody knows regular checkups are important, but when should I go? Yeah.
exactly. Especially since not everybody thinks that 30 is the cutoff time for us to go for a checkup because being in my 30s, I still think I'm young. So I don't know if I should go for a checkup. But right listening to you, I think I should book my regular checkup
Yeah,
as
and I
well.
think this notion that the 30s are new 20s has
Exactly.
further damaged this.
Yeah.
But what I'm trying to say is because our lifestyle has changed drastically. For example, when I was a kid, I was living with my grandparents in a village.
Okay.
So I was roaming around whole village every day. I was eating out of the fields. So that was a totally different thing. And what we are eating now from cold storage and processed food and junk food and all these things. So this and what we are doing in the name of exercise, screen time. So all these things have changed drastically. Because of that, the burden on our health has changed differently. So that's why we have to be more proactive at a younger age.
Okay. Okay. That is a very good information. And it is like a warning lights on for all of
Definitely,
us.
definitely, because I believe strongly in information.
Mm,
It's always better to know than not to not know.
right.
So I think, and being smart people, being people with having all the information at our fingertips, we should not be the ones sitting at home not knowing
Not knowing it.
on inside our bodies.
That's right. So now that we have been talking about hypertension and diabetes, there's something which goes hand in hand with these two chronic illnesses is obesity. So obesity and weight management are at this point it's a growing concern worldwide, especially in the Middle East as well, because given the amount of junk food which is available at our disposal, which is easily available at our disposal. So and also that now that you are an expert in this, so what exactly do our listeners have to keep in mind when it comes to where obesity and weight management?
To put in a simpler way, I always tell that diabetes, pre-diabetes, high blood pressure, high uric acid, fatty liver, sleep apnea, polycystic ovaries even, all these are sisters.
Okay.
and they have one mother that is obesity.
All right. Okay.
So, and that is the reason why I'm so enthusiastic about obesity, because it is something that when we control, we are improving all of these things. So it is one problem. If we are addressing in a right way, it will have outcome related to all the disease processes, all the warnings you are having, all the problems you are facing. So it is like nipping the evil in the bud. So if we are more mindful about it and doing right things about obesity, then we are fixing all these medical conditions. And because it shows such an improvement in all of them, that I think it deserves the attention, it deserves the uh, priority to be given to it.
So this was the driving force for you to dive deeper into weight loss and obesity, that you have decided to get your master's also in this field, is it?
Because when you work in internal medicine and when you work with the subspecialty of endocrinology and diabetes, every third patient you see is having the same issues. Every third person is having metabolic syndrome. And what is at the root of metabolic syndrome? Obesity.
That's right.
And at that time, again going back to that when you graduate from such an institute, they put this, I will say, this bug in your mind that you have to be best at what you do.
That's right.
So when I'm giving this advice to my patients to, just change this, change that, and lose the weight, it's very easy to say lose the weight.
It's not
But
very easy to lose the weight. It's
I
easy to
understand.
hear to it.
Yeah,
No.
exactly. And I think understanding that point was the key point where I decided, no, I want more information about it.
Yes.
I need to have more expertise about it so that I can help my patients in a better way.
Oh, that's really nice. So, what are some cultural and lifestyle changes or challenges you face with your patients when it comes to weight loss?
First thing is, even till date, there is a stigma attached to it. People are not very, eh, sorry, people are not very comfortable talking about it. So we have to start this discussion about weight in a eh, in a very, very polite way, in a very, very, sneaky way. You can say that we have to tackle it very sensitively, because many people can even get offended
Offended, yeah.
because and the second important thing is that many times in the families they don't talk about it at all. It is not talked about, it's not seen as a problem, it's just how the way you are. So then we have to give the patient this information that this is something that is not good for you, this is something that we need to think about, we need to make some changes about, and we have to fix it because it can give us a lot of problems with our health later on in life. So I think this is the first thing. Second thing, a roadblock that we face again and again is when it comes to the diet changes.
Mhm.
We tell them a lot of things to do, but because from coming from certain races, coming from certain nationalities, they are used to few foods or some choices in the food that they are doing since childhood. And it's very, very difficult
Difficult
to
to
break
change.
those eating habits in days or in months. So, for that reason, we have to go at the root of that. We have to involve the families as well. We have to educate them as well, that why they have to make certain changes in the style, the way they prepare the foods or the choice of foods itself. And the third thing is, some nationalities have a lifestyle where they are not doing a lot of exercises or physical activities. So that again goes back to that. We have noticed that a lot of Western nationalities, they are more prone to have, physical activity or playing a sport from the starting in the schools and all that. But other nationalities like South Asian nationalities, we usually think the only sport in the world is cricket. So
Okay.
that's there. So we have to tackle that. We have to motivate them on each and every step. And sometimes we do face resistance because of the long living, having these racial notions for longer period of times.
Actually, now that you talk about this lifestyle and cultural differences, I think I have to mention this. Like, there was some time back that I came across a reel of of a program happening in one of the South Asian countries. I don't wish to name the country, but it was a program where it is a competition, and you wouldn't believe the competition is for the most heaviest woman who is present in the arena there.
Uh-huh.
So the heaviest person will be gifted with a Suzuki bike.
Wow.
Okay. And they come and they were the ladies, they were actually upset when they were not reaching the benchmark that was set. And I have to say that the person who actually won the competition, she was weighing over 135 kgs. So does this also like I mean like me there would be many others who would have come across this snippet of reel somewhere else and it does leave a negative impact on
Yeah, this is sending
image.
the wrong message, to be honest. And this is again telling that I'm not saying there is anything wrong if you are on the heavier side, because it is not just what you eat. It's beyond that. When it comes to obesity, genetics has a very, very big role as well.
Right.
Even when somebody is obese and we make them lose weight with different modalities, even after that, our body has epigenetic memory. Our body will remember the way we used to look, and it will push us to go back to that point again unless we are resisting it. So I'm not saying if you are on the heavier side, there is something wrong with that. But if you don't realize that it's a problem and you do actively things to make it better for the betterment of your health, then this is wrong. And encouraging it otherwise sends a wrong message that
Absolutely.
nullifies what we are trying to teach today here.
Okay. And right now we have many people who have put on weight after the COVID-19 pandemic because of the lockdown and work from home. And those were the times when everybody, they didn't know what to do. So they were cooking and eating and the stress eating was a lot during that period. So has that period changed the way how you look at weight management and obesity?
Actually, it has done two kind of actions.
Okay.
So again, it depends from person to person.
Okay.
As they say, the same water, the boiling water, when we put a potato in that, it will be soft, and when we put an egg in that, it will become hard.
Hard.
In the same way, same situation alters people in different ways.
Mm-hmm.
So yes, there are people who had that fear of unknown
Okay.
during the COVID, and everybody handles stress in a different way.
Different way.
You're already sitting at home, everything is closed outside, you're working from home, there is no other entertainment just to eat or watch TV or some movies and all that. So, and after that, a lot of people were unable to get out of that cycle, get out of that lifestyle they made at that point.
Okay.
And yes, we have seen that obesity has increased post COVID times. There is a group of people as well who have taken it as a warning
Okay.
that how the COVID has come and it has affected those people more who were lower in immunity or who were not taking care of their health more. When they had to stay longer period of time at home, they felt how important it is the need to go out and do things. So we have even those people that decided to start a healthy lifestyle post COVID so that they become more strong if another virus, if another pandemic comes, they are in a better shape to deal with it.
That's very nice to know. I mean, this is another perspective. I thought because I was one of them who did not know what to do. I was neither of those two. I just wanted to get out of it to survive the COVID.
Yeah.
I was one of those people who
Because we
wanted
are
to do
all
that.
unique in our ways.
True.
We all respond to different situations in different
Right.
manners, and eventually we change ourselves for better or for worse.
That's right. Okay. And also, something which I have read about is that there are psychological factors which leave a deep impact on obesity. How do you tackle such patients who have this psychological impact? Uh, how do they follow your plans and everything?
The most important thing to know here is that mind and body are not two separate entities.
Mm-hmm.
I am a sum of my body and my mind.
Okay.
I cannot treat your body until I treat your mind, and vice versa as well. So, when it comes to obesity, psychological aspect is very, very important. And I cannot or nobody can treat obesity without tackling these issues. So, first thing when we are having first consultation with the patient, we discuss in a lot of details how they feel about it, what they have faced in their life because of this. And you will be surprised to know that the um, the struggles are very real. They will be bullied at school. They are dropped off from a lot of sports because of that, because they are slower than their peers. They will face body shaming when they are in teenage, and later on in life as well. They will always feel conscious. Even I know few patients of mine who will say, I don't like public speaking. And I will ask why, but you are very well versed. You have amazing things to say. He said, no, I feel very conscious when I'm standing on the stage. So all these things affect your mind in a very negative way. And you get more introverted, more cut off from people. You get less confident about yourself. And I think that is one thing that I see improving a lot as soon as we start losing some weight and we see some improvement. Even the patients, when I tell them in the beginning, you need to go to the gym, they say, I don't feel comfortable in the gym clothes, or I don't feel comfortable when other people will look at me in the gym. So please, doctor, give me some other exercise that I can do at my home or by myself, or I can go to the gym after hours, like after 9 p.m. when nobody is there. So these are very, very serious things when you think when you put yourself in that place and think that how negatively this issue is affecting your psychologically, you mentally, your physical, and all in general your health as well. That's why whenever we are dealing with obesity patients, we are discussing all the psychological aspects as well. We are discussing all the lifestyle aspects as well. We are discussing all the professional aspects as well. So treating a patient is treating the patient as a whole. It's never treating a disease or treating a lab result. I never do that.
That's very nice to know because this gives us an insight that chronic condition not just impacts our body, it impacts our mind as well.
Yeah, and the problem is we cannot effectively control it. We cannot effectively treat it unless we will handle the psychological aspects.
Absolutely.
For example, I have one patient. I gave them a medication today. After 3 months, he's coming back to me, and I ask him, "Are you taking the medication?" And he tells me, "I'm not." And if I will go and say, "No, no, no, you have to take the medication. You're not doing the right thing," I never do that. I will ask them, tell me what is stopping you from taking the medicine, why you're not taking the medication. And then the Pandora's box opened. Then they give us a lot of information. They tell us a lot of things, because when I'm with my friends, I don't like to take insulin because they will feel lesser of me. I don't take medicine because I feel like I'm dependent on them. I don't want to be dependent on them. So they have a lot of struggles going on in their mind. Until the time you will not address them, we will not have a good patient outcome.
Okay. Do you think Google search is one of the main reason for patients to feel like this? Because before coming to a doctor, every other person, they search for their symptoms in the internet and they come to a conclusion that they are suffering from this disease and they just come to you for confirmation.
I have a little different view about
Okay.
this. I always tell my patients, I'm very happy you Google searched it.
Okay.
Yeah, because I always prefer a well informed patient, or a patient who has a clue
Okay.
what it can be, rather than a person who is having all different kind of problems, but he is in a delusion that there is nothing wrong with me.
Right.
So if a patient thought about it and went to Google and searched about it, it means he is taking his health seriously. He is concerned about what's going on, and that's a very good starting point for me. And at that point, I tell them, okay, it's good you looked it up. It's good you are well versed with that terms, but 100% sure that most likely your headache is not the cancer.
Okay. All right. So now that we have all talked about all serious topics, now let's make it a little bit of fun. So right now I have a few things like I have a list of things for you, which you have to rank it from 1 to 10, being 1 being the least and 10 being the most.
Okay.
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 So walking for 30 minutes a day.
10.
10. Okay.
But I will just add something to that.
Okay.
Walking briskly
Mm-hmm.
for 30 minutes a day.
Briskly. Okay.
Yeah.
Using fitness trackers or smartwatches.
2.
Okay.
I don't like them
Okay.
because yes, it's good to know where we stand. It's
Mhm.
good to know what it's doing to our body, but over analyzing, over checking
Okay.
becomes obsessive.
So what about the step trackers and all those things you don't?
Again, my point, I respect your 10,000 steps if they are brisk walking.
All right.
If
Okay.
at least you have done them in bouts of 20 minutes or 10 minutes each while you were walking briskly. If you are just walking at a slower pace like that whole day because your job or your work requires it, and eventually you're saying, oh, I have 10,000 steps. And I think this is a notion that we have to address. Yes, as per the guidelines we say that 10,000 steps, it is still better than sitting whole day,
Mm-hmm.
definitely. But if you want it to be counted as exercise, at least it has to be in shorter bursts and it has to be brisk walking, because exercise is something which will increase our heart rate, which will increase our breathing rate, our body, it will build our stamina. Otherwise, we are not doing what we actually mean by the exercise.
Perfect. Okay. And what about checking your blood pressure at home?
10,
Okay. So using sugar substitute for managing diabetes.
0.
Oh, okay.
Yeah, I hit them.
All right.
Yeah, there are multiple reasons for that.
Mm-hmm.
Yes, it is very right. They don't have calories.
Okay.
However, they have certain compounds which will go and mess up our hunger pathways.
Okay.
Eventually, they will make us more hungry and we will end up eating more. This is one thing. Second thing is they can increase the cravings as well.
Okay.
Yeah, and eventually, overall, when we talk about obesity in general, if we look at the general or overall impact of that, it is negative.
Okay. So it's basically nullifies everything that you're doing. I mean, if you have,
Exactly,
yeah.
exactly. So maybe in a short span, if I'm using it once in a while,
Okay.
it's okay. But if I'm just drinking every day a diet cola or diet, soft drink, thinking that I'm not doing any harm to my body, I don't agree to this approach.
Okay. And so what about cutting salt completely for hypertension?
I would not say it's cutting completely. We usually recommend that don't put an added salt
Okay.
because our body needs some of the salt, some of the sodium. So just we can say reduce it to minimum.
Okay.
That would be amazing. Yeah. So 10.
10. Okay.
Yeah.
So how about intermittent fasting for metabolic health?
I really like intermittent fasting. We see amazing results with
Okay.
that. But of course, it's not for everybody. But I will say 7.
7. All right. What about commercial diet plans like keto diet, paleo diet, and all those things?
4.
4. Okay.
Because they work.
Okay.
But again, they are not for everybody.
Mm-hmm.
We should not follow them without proper knowledge, without proper discussion with the doctors, without knowing where we stand and what are our risk factors.
Okay.
And second thing, they are very restrictive.
Right. They
So
are.
it makes it very difficult to continue it for longer period of times.
Okay.
And in obesity management, the most important part is consistency, not what you are doing in one day, what you are doing in 1 month, after month, like that.
Okay. So BMI as a reliable indicator for health.
4.
4.
Yeah, because BMI is just the tip of the iceberg. There is a lot that is underneath.
Okay.
So now we have moved, when especially we are dealing with patients with metabolic syndrome or obesity, we are focusing more on waist circumference, waist to hip ratio. That are better indicator of the visceral fat. That is actually the bad kind of fat,
Mm.
which will cause the metabolic syndrome.
Okay. That's nice to know.
Yeah, what I'm trying to say is even if your BMI is normal,
Mm.
even if you look lean to look at, still you can have more visceral fat and still you can be at higher risk of metabolic syndrome.
All right. Okay. What about green tea for boosting metabolism?
As they say, green tea can boost your metabolism if you go to the mountain and pick it up yourself.
Okay.
So I would say 4 because
Okay.
it has some antioxidant. It helps to keep you hydrated, but not for weight loss per se. Unless you are replacing your coffee or your tea with green tea. So definitely we are cutting on to that calories. So that's a good start for sure.
Okay. So what about prioritizing mental health equally with physical health?
100.
100.
Yeah.
Okay. So because that's the most important.
Yeah, because unless we will fix what's going on in here, we can never fix what's going on in here. So that's how it is.
Okay. So Now that we had a good round of this ranking, let's go ahead and do a rapid fire round. So, rapid fire round, it is like I'll just tell you a set of questions I have prepared for you. I tell it to you, I ask you that, and you tell what comes first to your mind.
That's interesting.
Okay.
Yeah.
So, one medical myth you wish everyone would stop believing.
I would say the same thing.
Mhm.
If I take a medicine for chronic disease, I have to take it for rest of my life.
Okay. Coffee or tea during your long shift?
Tea, always.
Always. Any reason why you prefer tea?
I'm from Pakistan. We love chai.
Oh, okay. Your go-to stress reliever after a hectic day?
Most likely a walk on the beach. I do yoga as well, and I do swimming as well. So it depends on the day, what is more accessible.
Okay. If you weren't a doctor, what would you be?
An artist. I love painting.
Oh, that's nice to know.
And even when I did the entry test that is needed for the medical school, so at the same time, I put an application for NCA, the National College of Arts in Lahore.
Oh, nice.
So if I wouldn't have gotten into the medicine, I would have been an artist.
Nice to know. A book or a podcast you recommend every healthcare professional to come across?
Atomic Habits,
Okay.
and not just for healthcare professionals, for everybody.
Okay.
Atomic Habits is by James Clear,
Okay.
and where he talks about how we can break the old habits and build up new habits. It's very, very helpful book.
Your favorite part of being a doctor?
Being able to be with somebody when they need you the most.
Nice. One lifestyle change you wish more patients would do?
Start walking.
Start walking. Okay. What's more important, diet or exercise?
It's like Batman and Robin, but definitely diet.
Okay.
Exercise has it's a huge,
Okay.
but when we are comparing the both, definitely diet.
Definitely diet. Medical advancement you're most excited about?
We will focus on the conditions we discussed today.
Okay.
So one I really like is CGM, continuous glucose monitoring,
Mm-hmm.
that you can just put a sensor here and your blood sugar levels will keep coming on your phone for next 2 weeks, and you can share that data with your doctor. It makes us very easy for us to see where we stand and what we need to do. And second thing is the new medications we have, GLP-1 agonists. Like I will not take the brand names, but these have revolutionized the management of diabetes and the management of the obesity per se as well.
Okay. That's very informative. One word your patient often use to describe you?
A good listener.
Okay.
I'm very empathic. Yeah.
Okay. So that comes to the end of our podcast. And thank you, Dr. Maria, for coming to our podcast. It was a pleasure to host you today. And I hope you had a great time.
Thanks a lot for having me here today. I had really a lot of fun. And actually, I think the things we talked about are very, very relevant. And these are the things everybody should know.
Should know.
And because this is the basic, and I think today in the social media has given us an opportunity to go and reach people beyond face to face interactions. So I am so glad and I'm so happy and so proud of you that you are doing this initiative to help our audience, to help our listeners as well.
Thank you, Dr. Maria, for coming to our podcast. And as a token of appreciation, we have a very small gift for you, and I really hope you would like it.
So kind of.
This one is from us to you.
Let's see what we have here. Oh, it's amazing. Thank you. Thanks a lot.
I'm happy you like it.
Yeah, I really like it.
Thank you so much. And thank you to our listeners for tuning in. We hope this episode helps you take charge of your health. Be sure to subscribe and share, and we'll catch you next time on Scrubbed In. Stay healthy and take care.